Right, well, today we're here to talk about the latest Wells Audit Office report, which is on the out-of-hours service, and I'm here with the report author, who I will let introduce to camera.
I'm Steve Lyle, I'm a project manager here, and I led the work on out-of-hours.
Cool, so, I mean, the really simple question is, what is out-of-hours? What's this report all about?
It's not as simple a question as you'd think. Out-of-hours are actually quite difficult things to define. They're called different things by different people. So some people call them GP out of hours, some people call them urgent primary care, some people call them primary care out of hours. So that's one of the issues that we've kind of highlighted. But basically, they're really important services. They're used by people who have urgent primary care needs at a time when their GP practice is closed. And they provide services that are over and above what you get from a GP. It is primary care in its widest sense. But they're really important because people have this urgent need and they have to access them urgently.
So, I mean, the question I suppose we should be asking ourselves is, what have we found? Is there like in simple term, is there like one national standard for everything, or are there lots of different places doing lots of different things?
There are national standards. So there are standards that each service should be complying with. We found that all services are struggling to cope. They're struggling to actually deal with those standards. They're not complying with them. And overall, we found that these services are under strain. So they are having staffing issues, there are issues with morale, they're not meeting the standards, particularly on timeliness of services. So yeah, they're having difficulties. But having said that, I said they're really important, they are. And we spoke to patients, so we had a patient survey, and patients actually really appreciate these services. So it's important not to forget that point as well.
Yeah, definitely. So in terms of like the way that we've gone about doing this work, I mean, have we done anything interesting in here? I mean, there's something in there about mystery shopping. I don't know if you want to give us a bit more information about that.
Yeah, so we did the standard kind of audit work, but we also surveyed patients. We surveyed staff working in these services, and we did mystery shopping, which in this case involved assessing websites, so assessing health board websites and GP websites to see what information patients can get from those websites. But the other part of mystery shopping was that we actually did telephone calls to out-of-hours services. So during the out-of-hours period, we called GP practices to see what happened, to see, you know, if you were a patient calling a service, what would happen, what would you experience? And it was fascinating, really. It's quite confusing for patients, so we found quite a lot of variation in how these services were described. So they're called different things by different people, and the circumstances in which you're supposed to use them. The descriptions of that also varied from, contact this service if you're having an emergency, which isn't supposed to be, it is urgent, not emergency care, all the way through to if you can't get your GP, contact this service. So a real kind of confusing range of circumstances in which people should be contacting these services.
Yeah. So what were the findings, what were the recommendations that we made from all of this work?
So we made 8 recommendations. I won't go through them all now, just kind of direct people to look at the report. But we made important recommendations about coming up with a national workforce plan, about improving signposting for patients so they can understand how to access services better, and about reviewing leadership arrangements as well for these services.
Thank you very much, Steve. Really appreciate that. You'll be able to get access to the publication, which will be on our website, and all the details will be on the screen for you now. So just thank you very much again.